Hey, so you're expecting a baby. How exciting. Congratulations. I am just going to walk you through a little bit of like how this is going to go. And I just want to say, trust your doctors. We are trained professionals. And, never mind that the medical industry was bought out in the 1950s by like the Rockefellers or something like that. Um, but they changed the whole curriculum and they kind of only teach us what they want us to know. But, we do the best we can, right? So, okay, you're pregnant. Don't eat a lot of like fish, especially like tuna, because it's like loaded with mercury. But we are going to recommend that you get a flu shot, which has like, I don't know, 14 times the amount that one industry like recommends is like safe for your drinking water. Yeah, but definitely gonna want to get that. The flu is like not really something you want to mess with. Okay. And if you're RHO negative, you're gonna need a RhoGAM shot. That's also gonna have a lot of mercury, but like don't worry about it. Yeah, like mercury is toxic for the body, could cause a lot of damage, but the doctor recommends it. All right, and then you're definitely gonna have to get tested for gestational diabetes, like even if you're not at risk. So you're gonna drink this like really nasty, thick, like orange soda tasting type of drink, before you can get this test done. And it has like this stuff called like brominated vegetable oil. It's really bad for you, but don't worry about it. It's safe and effective, like the doctors recommend it. So this test is absolutely necessary. Um, yeah. So once you go into labor, you come right in, just sign a little waiver, like sign everything over to us. We're going to take really good care of you. Oh, yeah, we'll make sure we give you a lot of ultrasounds while you're pregnant, too, because your baby totally needs all that radiation. But once you get in the hospital, we'll hook you up to a bunch of machines. We'll totally give you medicine, so don't worry about the pain. Like, your body could probably naturally tolerate it and, like, naturally push the baby out, but we'll just give you meds right away and make it probably more difficult. You're going to have to push really hard, but we're trained, so we'll help you. And yeah, so what else? Let's see. Once your baby is born, we're gonna clamp the cord right away because your baby doesn't need the cord blood or stem cells or anything like that. It's not really important. So don't worry, we'll get rid of the placenta for you. No worries. And then we're gonna give your baby a vitamin K shot, which it's black labeled. That means it's really dangerous, but don't worry, like it's just a vitamin. Your baby needs it. So let's see, what else? Hepatitis B for sure within the first 24 hours, like even if you don't have hepatitis B, and it has like a lot of aluminum in it. You could probably make like 20 cases of soda with it, but your body totally will detox like that stuff naturally, heavy metals and stuff. Except that your baby could like get a reaction and get a fever, and then you would have to definitely like give your baby Tylenol, and that would actually inhibit your body's ability to detox from heavy metals. So, but the vaccines are completely necessary because like you don't want your kid like dying from like some disease that you didn't have. And let's see what else. We're gonna give your baby a bath right away, because like that yucky like waxy coating, just wash that off. Like I think it's called the vernix caseosa, and it might be there to like protect the baby from the transition from the womb to the outer world, but we're just gonna wash it off, so you're welcome. um and that could be why the baby's skin gets so dry, but yeah. Then let's see what else. If your baby's a boy, yeah, we're definitely gonna have to like strap the baby down and like cut a little piece off his genitals because it's just cleaner that way, and it's just so much easier for you. Like they don't need that extra skin that like has all the extra nerve endings that's gonna like give them like extra pleasure and stuff. They don't need it. And then let's see. Once you go home, we're going to recommend that you come in to see the pediatrician at least like once a month, and we're going to give you like several doses of different vaccines for viruses that like declined and almost diminished before these vaccines were ever introduced. But and they just keep adding more to the schedule. I think it's because they get a lot of money for it, you know, and like since 1986, the Childhood Vaccine Injury Act, like we don't get in trouble for any injuries. Like we don't even record them because I was never taught about VAERS, the Vaccine Adverse Events Reporting System, you know, like I'm supposed to. But anyway, you know, if your child gets a reaction after one of these, it wasn't the vaccine anyway. So like totally don't worry about it. They're totally safe and effective. And so you're gonna come in like once a month for a few months. And your baby's gonna get like a total of like, I don't know, it's like 90 shots now. By the time they're 18, you get like 26 in the first 6 months. It'll totally inhibit your like baby's ability to boost their own immune system because they actually really don't have an immune system except for like yours. I mean, and if you breastfeed, like that would totally enhance their immune system, but don't worry because we'll have formula like readily available for you. So, you know, you don't have to worry about breastfeeding. Let's see what else. Yeah, so that's pretty much about it. Like I said, if your baby has a reaction, no worries. It was definitely not the vaccine. Don't bother reading like the insert. It has a whole bunch of information that you probably wouldn't understand. So you can just check out this little sheet, gives you the basic info. You can just sign right there, and we'll have you taken care of. And yeah, congratulations.